Welcome back to Cancer Buzz TV. I'm your host, Summer Johnson. Adolescents and young adults face unique challenges during treatment, so it's important that their care is tailored to address their specific needs. Today's show is a special edition created and sponsored by state oncology societies across the nation. We're going to discuss multidisciplinary collaboration for building programs that meet the needs of these patients. In this episode, we'll cover everything from a personal journey of care after cancer treatment to providing psychosocial support and what it looks like to train PCPs for AYA survivorship care. We're starting the conversation with Scott Capozza. He's a board-certified clinical specialist in oncologic physical therapy, and he's a cancer survivor. Scott, tell us what it was like to navigate care after treatment.
So one of the many challenges for young adults when they're diagnosed with cancer is the aftercare. And really the question becomes, whose responsibility is it to monitor those late effects that can pop up for young adults especially. And I will fully admit that I was like any other 20-something in the sense that I never really had a primary care physician. Obviously, we all had pediatricians when we were children, but I never actually had a primary care physician. I always used my oncologist to kind of manage everything, kind of manage my follow-ups and everything, which was all well and good in the sense that I'd go and I'd have my blood work done and I'd have my scans done. And I said, well, why do I need a primary care physician? Because I've got my oncologist. But I eventually got to the point where I graduated from my oncologist. And so I needed somebody to kind of manage, my health concerns and my health needs, even just the normal things like to schedule a colonoscopy and to do blood work, but then to really help with the more specific things, some of the late effects that I was running into, which included decreased tolerance to exercise. And so he was the one, when I finally got connected with a primary care physician, he was the one that put the referrals in for cardiology and the referrals for pulmonology. And so, and it was my interaction with the pulmonologist who, looked at me from the outside and looked at my, my history in the sense of non-smoker, not exposed to any chemicals or anything like that when I was growing up. And yet I failed my pulmonary function test. And he looks at me and he says, I don't get it. You don't fit the bill for somebody who just flunked their pulmonary function test. And I said, well, I had bleomycin chemotherapy. And he said, oh. And so he just went ahead and made this assumption. And so that was kind of the impetus behind me writing the patient is otherwise healthy article that was in JCO Oncology Practice in 2024, because the late effects especially for young adults are very real. And a lot of times they are not recognized because we look otherwise healthy on the outside, but that kind of belies what's going on internally.
Thank you, Scott. We'll put a link to that article you wrote in the show notes. Let's move on if you're willing to talk a little bit about your experience navigating fertility preservation. Who initiated that conversation? Was that from you or was that from your care team?
So that actually started way back when I was diagnosed with cancer. And thankfully, I had a surgeon who was thinking ahead for me. When I was initially diagnosed, I was 22 years old. I was in grad school and I was not in a relationship at that time. So the thought of having a family was the farthest thing from my mind, especially try to navigate this new cancer diagnosis. But it was my surgeon who actually was thinking ahead for me. He had done plenty of surgeries for young guys with testicular cancer. And he said, listen, the surgery that I'm about to do is pretty invasive. There could be the potential for nerve damage. And then if you are going to be looking at chemotherapy also in the future, that could affect your fertility as well. So you need to do sperm banking, and we're going to give you 4 weeks before we do surgeries to give you time to do the sperm banking. So it was actually my surgeon, my oncology surgeon, who started that conversation many years ago, right from when I was early on diagnosed.
Thank you for sharing that reminder to providers that they could be impacting your quality of life way down the line by initiating these conversations. Now that there's been some time, when you're looking back, reflecting on your journey, what support or resources would have made that transition to survivorship smoother?
There probably could have been a better opportunity for mental health. And I do remember when I was getting chemotherapy, there was a social worker, and she did come over and she did approach me, and she said, "Well, we do have a support group that we offer here at the cancer center." But I looked around, and I was the youngest one in the chemo room by 30 years. And so the intention was good, the intention was there, but it would not have done me any good to go to a support group where I'm in my 20s and everybody else is in their 50s and 60s. They've already had their families. They've been working for, 25, 30, 35 years. They're closer to retirement than they are to starting their career, which is where I was. And so to have not just mental health services, but specialized mental health services, to have specific AYA support groups, to have social workers and psychologists who are trained to recognize the needs of AYAs, I think is very, very important, because again, you can't just put a 25-year-old in a support group with a bunch of 55-year-olds.
Thank you, Scott. That was a very valuable conversation. Bouncing off what Scott just brought up, our next guest is joining us to talk about psychosocial support. Melody Griffith is an oncology social worker who works with AYA patients. Melody, tell us more about your work.
So I'm an AYA oncology social worker. And before I was officially in that capacity, I worked here at Mayo to help build the program that we have now. So we're still a fairly new official program, but we wanted to keep in mind from the very beginning the trajectory that young adults go through during a cancer diagnosis and survivorship. So we have put together, we used what's called the Needs Assessment Service Bridge that was created by Wake Forest Cancer Center. And that helps us get from the young adult's perspective what they're interested in and what they need. And so we use that information at the very beginning when we first come in contact with them to ask them what's important to them. And based on that, myself or one of my colleagues, we have a patient navigator and we have a nurse navigator who works specifically with young adults. We meet with them and we talk to them about those things that they brought up. And then we check in with them throughout their cancer treatment. And then into survivorship, we know that that is when sometimes the harder stuff starts. And so we are there to help kind of bridge that gap from when the oncologist says, okay, you're good, congratulations, to now what do I do? And how do I go back into regular life? And so I actually developed curriculum with another one of my social work colleagues for a survivorship group. It's a 6-week group where there's different topics each week. And we select the patients. It's part of a research study, so there's a little bit of a process to get selected for that. And we meet for 6 weeks in a row where we talk about these topics and they have peer support. And so that helps them bridge that, what do I do now, to, okay, I feel like I have the tools to go forward in survivorship. Of course, that's not all inclusive, and we still remain available for one-on-one counseling, connection to resources, and a lot of just normalizing that what they're going through is normal. Other people feel that, and that we're here to support them in whatever way that looks like for them.
We heard from a guest right before this, and when he was going through treatment, he was approached to join a support group, but he was looking around and didn't see anyone his own age. So when you're working with support groups, is that front of mind?
Yes. And so we've had a support group that's been going for about 8 years now, that is for any young adult, so ages 18 to 39, who is going through any kind of cancer treatment or has had cancer during that age range, and is now out of cancer treatment. So we have some people that come to group who are 7 years out from their treatment, and they still come to group because they feel like they get something from it, but they also are able to give back to people that are newly in the process. So that's for anybody at any stage. Then this survivorship group is for people, it's specifically designed for people who are 6 months to 2 years out from completing their treatment. And we talk about things like relationships, going back to work or school, also the psychosocial impact of cancer, and then the transition into survivorship. We talk about post-traumatic stress, but also post-traumatic growth and what they bring with them and what they've learned through their process.
It's not just the treatment, right? After treatment, there's a lot of years left to live. When we're talking about transitioning to survivorship, what should we keep in mind?
The transition to survivorship is an interesting one for people to navigate. A lot of times we find that people are very excited and happy to go into survivorship, but also really scared or unsure of what to do. So the biggest thing that I have seen that our providers can do and what I can do in my role as a social worker is to prepare them for that and to say, hey, there's going to come a time where you finish your treatment and you're not going to be seeing us as much as you used to. And that can feel weird. And then it can feel weird to feel weird about that because who wants to come to the hospital or the cancer center? Nobody. And a lot of times for people, they have felt like their life has been on pause and that maybe they're behind their peers now. So when they've had treatment for 3 months or 6 months or 2 years or whatever their treatment has been, and then we throw them back into the community, into their regular life, they sometimes feel like they've missed out on an opportunity to do what they needed to do. Some people have dropped out of school. Some people have passed up promotions at work. So trying to figure out who they are in those aspects is important. I think providers can normalize the situation and say, we know that this can be difficult and our support doesn't go away. It just looks a little bit different. You can still ask us any question. I know fear of recurrence is huge for a lot of people. So normalizing that you will be having certain things that still happen to you physically and emotionally after treatment. And those things are normal. And if they're not normal, we're going to address them and we can work with you to make sure that your questions and concerns are being answered. And it doesn't make you crazy. It doesn't make you like that you just can't handle this. It just makes you a person who's going through a tough time and transitioning into the next phase of it.
Thank you, Melody. We'll turn to our next guest to wrap up today's discussion on AYA care. Dr. Cathy Lee-Miller is the director of the AYA Oncology Clinic at the University of Wisconsin Carbone Cancer Center, where her team is training PCPs specifically for AYA survivorship care. Dr. Lee-Miller, tell us a little bit about your PCP training program and cohort.
One of the motivators to start our PCP training for AYA survivorship is that we found that PCPs wanted to learn more. And we knew this because we did a survey of internal medicine general practitioners to ask them what their comfort level was with survivorship amongst a cancer population, and specifically amongst the adolescent young adult population. And what we found is that the vast majority of them did not feel like they were prepared to see those patients in clinic simply because they hadn't been trained to do so. So in order to address that training gap, what we came up with was what tried to be a fairly quick and high yield series of lectures focused on what the most pertinent topics were in cancer survivorship for adolescents and young adults.
What have you learned about engaging PCPs?
PCPs are busy. So busy. They're seeing so many patients. They are managing not just their physical health, but their psychosocial health. And people are relying more and more on their PCPs. And so what we learned is that we really needed to make these training sessions as high yield as possible. And we tried to do that by keeping them to an hour and varying the times at which we held them. So they weren't all in the morning, they weren't all at noon, they weren't all in the evening, but we tried to mix it up so that, and mix up the days of the week so that we weren't just, catering to certain people with certain schedules. And then, we also learned that they have a lot of experience with caring for cancer survivors of all ages, but specifically for AYAs. And they've figured out a lot on their own. And so being able to give them the resources to kind of be able to look at and use in real time was probably the most valuable thing. So not just the material we covered during these lectures, but also what were the take-home things? What could they, bring home with them? Getting the websites of where these resources were was very, very valuable. And I think the other thing that's been really helpful from my perspective as the director of the AYA Oncology Clinic is now when I have a patient who is a survivor of cancer and they're looking for a PCP, I have this list of PCPs who have a specific interest in that field. And based on where they live, I can usually find them a PCP that's convenient for them.
Right. That's another thing that Scott brought up earlier between finding a PCP and getting referred to other providers. Not every doctor is aware of your medical history. So I'm wondering, how do you support community providers who may have fewer resources compared to a larger academic AYA cancer program?
That's such a good question and so tricky and something that we're still, striving to do better on. I think one tool that we really try to use is called a survivorship care plan, which is built into our electronic medical record. And what the document is supposed to do is serve as a summary of all the treatment they've gotten that was cancer directed. So again, maybe that's surgery, radiation, chemotherapy, any of that. It should summarize all of that care, and it should lay out a plan for surveillance through the future, and not necessarily cancer surveillance, right? So at that point, we're less worried about, recurrence or relapse of the cancer, and more, what is the surveillance for long-term complications as a result of the treatment that the patient received? So if they got a certain class of medications, maybe they need echocardiograms at a certain interval for the rest of their lives. If they've got a different class of medications, maybe it's something that we're worried about their kidneys or their hearing, and those need to be monitored really closely. Maybe they need to be seeing a dermatologist once a year. And so what we try to do is in that survivorship care plan, lay out not just what treatment they receive, but then also, okay, because they received this is now what our surveillance plan should be for the next 5 years, 10 years, or maybe the rest of the patient's life. That kind of document is super important and very, and it should be shared not just with the oncologist and the PCP, but also the patient themselves. We really try and help empower these patients, particularly AYAs, who maybe they relied on their parents for their medical care before. Maybe they just went where their mom told them to go. And so they don't actually know exactly the details of their treatment. And so we really try to spell that out for people so they can take responsibility and take charge of their own long-term health.
Thank you to our guests today. This podcast was developed as part of the AYA Oncology Screening and Survivorship Services Program, made possible through the support from the Arizona Clinical Oncology Society, Indiana Oncology Society, and Wisconsin Association of Hematology and Oncology. The show notes have links to adolescent and young adult cancer resources. Until next time, from the team here at Cancer Buzz TV, thank you for watching.